Welcome to Provincial Case Rounds for the month of April. My name is Nick Hume. I'm the Healthcare Professionals Training Officer for BC. Today we have joining us a special guest from one of our sister or partner agencies. We have Constable Dennis Bolio, pardon me, from the RCMP North Van Municipal Traffic Services investigator. And he also happens to be our Provincial Cadet Sergeant Major for St. John Ambulance as well. But he'll be talking today about crime scene management for healthcare professionals.
Perfect. Thanks, Nick. Well, good evening, everyone. I hope my connection is not lagging too much. I'm doing this from a hotel room. So welcome to my presentation on crime scene management for healthcare professionals. This presentation has basically been adjusted for healthcare professionals. Normally, there's different things that we do as law enforcement that healthcare professionals might not be expected to do or isn't in their mandate. So as Nick stated, my name is Denis Beaulieu. For those who don't know, I'm a peace officer and a regular member with the RCMP and have been for 6 years now. I've investigated multiple crime scenes over the course of my duties. I'm not an expert by any means. However, I do have first-hand experience and training with preserving evidence for court purposes and such. So I was asked tonight to give this presentation by a colleague of mine to enlighten healthcare professionals on the crucial role that they play at crime scenes, or even handling items that may be linked to crime scenes, and how they can help investigators maintain the integrity of the evidence and the chain of evidence. This is also known as the continuity of evidence. So a few things to note that this presentation is not necessarily exhaustive and techniques are always being developed. However, my goal for this presentation is that it will provide you with some information to make some informed decisions, or at least be aware of your actions or inactions that might happen from attending a crime scene or even handling that evidence per se. So if you remember anything from this presentation, just remember this: every contact leaves its trace. And my intention is to elaborate the meaning of this phrase and clarify any ambiguity that may exist with this phrase in itself. Basically, it's just to, again, bring awareness to crime scenes and the evidence that they may contain. So topics or the main points that we're going to cover today will be: what is a crime scene? Why is a crime scene important? Locard's exchange principle, crime scene strategy and basic principles, considerations on arrival, approach, and evidence management, as well as some case studies, some tips and tricks to preserving evidence, and crime scene assessment flow chart at the end. Basically, just a point form, easy to remember guide. What is a crime scene? A crime scene is an area that contains physical evidence pertinent to a criminal investigation. Physical evidence often provides investigators with leads or evidence of a crime and helps to develop the flow and direction of a case. And what I mean by this is sometimes we're given evidence that links us to another set of evidence, and it just helps the case flow along, and these are often called leads. The crime scene can be either a place where the actual crime took place, or it can be any area that contains evidence from the crime itself. So healthcare professional often will arrive at scene prior to law enforcement. Thus, due care and due diligence must be exercised when entering a scene. While entering a scene to attend to the wounded or people in need of help, healthcare personnel may be walking through what is known as a primary scene or a secondary scene. And so a primary scene or primary crime scene is defined as the original location of a crime or accident. And for an example of this would be a murder scene. This is where the primary crime was committed, and this is likely where most of the first responders or healthcare professionals will end up or be required to attend during the course of their duties. But throughout that process, they may be walking through a secondary crime scene, and a secondary crime scene is is defined as an alternate location where additional evidence may be found. So an example of this would be a vehicle used to store a murder weapon, for example, if the person had killed someone and had stashed their knife in the vehicle, that knife itself would be crucial to the murder investigation. It's the weapon that the murder was committed with. So the blood off that knife might transfer onto the seats of the vehicle, and thus that vehicle will contain evidence linking that murder weapon to the scene. Also, sometimes a path taken by a criminal can be considered a secondary scene. So an example, a simple example would be a gas station, for example. Let's say a gas station was robbed at gunpoint. The inside of the gas station would be considered a primary crime scene, while the outside of the gas station would be a secondary crime scene. So if, for example, the suspect decided to smoke a cigarette on his way to the gas station and then drop that cigarette just outside the gas station before entering, that would be a secondary crime scene where you would pick up that cigarette butt and you're able to link that suspect to that crime scene because of that evidence, that DNA evidence that was found on scene. Now, in the case of a hospital worker, they never quite make it to scene. However, the scene comes to them, meaning there's bloody clothing, there's the wounds, there's the weapons, all that sort of stuff. That they're still on the people involved, whether they're the suspects or the witnesses themselves. These items are just as important as the scene itself, as they connect the individual to that location and incident. So basically, a crime scene is any physical location in which a crime has occurred or is suspected of having occurred. And the scenes and items related to these scenes should be treated with care and secured as much as possible to preserve and protect all the evidence contained within. You might be thinking at this time, why is a crime scene so important? Well, a crime scene will demonstrate that a crime occurred. It'll link the suspect to the scene or the victims to the scene. It also helps to establish the identity of victims or victims and or the suspect or suspects. It may help corroborate testimony from witnesses on scene, and sometimes it'll exonerate the innocent. So if someone is falsely accused, they may be put in a bad position. Basically, the DNA evidence or any of the evidence found on scene will help prove or disprove that that person is involved or not involved. So ultimately, a crime scene is basically the crime scene, and the investigation of the crime scene is about discovering the truth. And every scene and items linked to the scene tells the story. It's basically piecing the puzzles together and building the story and finding out the truth. So there's a thing called Locard's exchange principle, and Locard's exchange principle is simple in itself. It's basically saying it's a simple principle, however, it's often forgotten. This is why you'll see most investigators wear gloves when they're handling a crime scene. Sometimes they'll wear hairnets or face masks or even full bunny suits for high-profile cases. And so this is done because Dr. Edmund Locard was basically stated that every criminal can be connected to a crime by small particles carried from the scene. However, when two objects come into contact with one another, a cross-transfer of physical evidence can occur. And the intensity and duration and nature of the materials in contact determine the extent of the transfer. What this basically means is that we can identify criminals by way of these particles, also known as DNA. However, the same can be said about responders and health professionals. People who are not careful in handling the evidence may contaminate or inadvertently erase any evidence that was present. Example, and I see this all the time when I go to hospitals to speak with suspects or victims. Basically, the nurses or hospital staff will start cleaning the suspect's wounds. And it's not because they're trying to be malicious or anything. They're essentially doing their job. But by cleaning the suspect who's involved in an assault case, for example, If you're cleaning the suspect's blood, you might also be cleaning the victim's blood. You might be cleaning the suspect's clothing, but potentially erasing valuable DNA evidence. Or if you're removing the suspect's clothing, you might be potentially contaminating the source of evidence. So if you're mixing the suspect's clothes with the victim's clothes, or if you're just throwing it at any random garbage, potentially that DNA is going to be lost. Or if you're not careful in handling that, they might find some of your own DNA on that clothing or that evidence. It's not a major issue if they find your DNA per se, because they can take some of your DNA and say, well, no, this is this person's DNA. They are obviously not of the crime, and it was just for whatever reason it ended up on that piece of evidence. But in the case where evidence is destroyed, for example, if you take a knife, for example, and you pull it out with a rag, you're potentially wiping fingerprints, and this is where it becomes crucial to preserving this evidence. Thus, it is important to carefully handle the evidence and document any actions taken if possible. I realize when someone is being rolled into the hospital from a serious car accident or a pretty bad assault, it's not necessarily feasible for people to break out the notebooks and start documenting everything that they're doing step by step. But the same is expected from law enforcement. We're not going to pull out notebooks and document everything. Typically, it's done after the incident has finished and everything's calmed down. So now you may be wondering, but how am I supposed to do my job? This is the million-dollar question, and the answer is quite simple. Very carefully. You may not be able to prevent all contamination or save all the evidence. However, taking proactive steps and employing a systematic approach may reduce any potential damage to the evidence. Taking an extra second to carefully handle a knife or bloody clothing could be the difference between finding the suspect and creating another cold case. According to CanCrime.com, there's approximately 3,400 unsolved murders in Canada as of October 31st, 2009, and approximately 90 murders go unsolved. How many of these could have been prevented? How many of these had a sole piece of evidence that was destroyed by accident? Again, you won't be able to save all the evidence, but a conscious effort can go a long way. So, crime scene strategy and basic principles. A crime scene search is planned, coordinated, and executed by law enforcement officials to locate physical evidence. Typically, general duty members will investigate a common scene, such as a break-and-enter, robbery, etc. These members attend the scene and gather any and all evidence present at the scene and build a case based on that. However, for more serious offenses such as murder, a specialized section known as Forensic Identification Services comes into the scene to gather the evidence. They're basically the CSI of the TV shows that you commonly see on all the shows running on Spike, for example. So your actions or inactions against anything related to the scene may be of value, which means you may be also called to court as a witness to explain why your actions or why you did what you did or why you didn't do anything. So documentation is very important, and these notes often help refresh your memory 2-3 years down the road at a criminal court trial. So a few strategies to think about when arriving on scene are basically this is the way they teach us, and it's not wrong for anyone else to do it. You don't necessarily have to be a person of law enforcement to take these steps. But basically, the first person to arrive at scene is responsible for securing the scene, the crime scene. This isn't always an easy task, but sometimes it is required. And so while the first priorities for others should be giving medical assistance to individuals needing it, it's important to do both. If we can control who has access to the scene and who's able to enter the scene, then we can control how much contamination or how much destruction of the evidence is occurring. Again, if this isn't necessarily the job of the healthcare providers, but sometimes arresting a suspect or identifying the suspect and incorporating all the witnesses is also valuable. Arresting a suspect, I wouldn't necessarily recommend it for somebody who's just murdered someone, but there are provisions of the criminal code for any citizen to essentially arrest someone until the authorities arrive on scene, and at which point you would turn over that person to the authorities. If they're going to fight you, if they've got guns or knives, I wouldn't recommend it. I mean, your safety is key, but every little bit helps. I've had people basically take pictures of license plates, take pictures of the people involved, and then they turn over those pictures to myself or other investigators on scene. And those go a long way, because then the person can essentially not say they were never there. There is a picture of them on scene, so it's a little hard for them to build a defense based on that. And so the last point, as soon as it's possible, effort should be made to exclude all unauthorized personnel from the scenes. So there's some people that are, we call them looky-loos, that are just there to seek thrill or just to see what is happening, but they have no actual involvement with the case. That they basically serve no purpose, and you want to get them out of the way, not because they can't be there, but by being in the scene, they're essentially contaminating it, or they might be inadvertently destroying evidence that is present for and waiting to be collected. So typically in a populated area such as the Lower Mainland, police generally arrive at the same time or shortly afterwards. So this is not necessarily a concern for most. However, it is a reality that some may encounter, and they encounter this, and any assistance is generally appreciated. I'm speaking mostly about northern places where police response can be 20 to 30 minutes. That's not necessarily the case in Lower Mainland, because there are so many police detachments in surrounding areas. Thus, it's the response is much quicker than somewhere who would be up north, for example. So considerations on arrival, approach, and evidence management. Here are some considerations on arrival approach to a crime scene and when dealing with evidence associated with the crime scene. Again, this list isn't exhaustive. However, it provides you a point to start, start points to consider. Considerations include, but are not limited to, the boundaries of the crime scene. So where does the crime scene actually start? Where does it end? Does it involve one room, or does it involve one city block? I've been to crime scenes where it's literally one room, and I've been to crime scenes where it's they start off with one entire block and work their way in as they discover that that portion of the investigation is required. For example, a case that comes to mind, probably I'd say about 6 months ago, there was the murder of a Hells Angels associate in Langley, and they essentially took one city block for that until they realized it was essentially just a 500-meter radius, and so they slowly brought that crime scene in and were releasing rows to the public that way. So the boundaries are important, because it's better to start big and work your way in, as opposed to start small and trying to expand that boundary to greater lengths, because once people are in those boundaries, they may have destroyed that evidence again, they may have contaminated it, there are so many possibilities of things that can happen if you don't control it from the start. Another point would be avoiding contaminating the scene, and how can you avoid contaminating the scene or items associated with the scenes? Would it be wearing gloves, wearing face masks, bagging items separately, avoiding cross-contaminations, or even wearing full bunny suits, right? It depends on what situation you're into and how much time you have, or what's the dire need of. of the situation that's going on. And I can appreciate that some of these situations are very dynamic sometimes. Preserving evidence. There's many ways you can preserve evidence, and I'll touch on this a little later as well. But basically, everyone has a phone these days, or a smartphone. You're able to take pictures. So if you, for example, are working with EHS or you're a first responder, and you happen to come upon this person who, for example, was stabbed, there is no problem in helping that person. Maybe consider taking a picture of how they were initially. This can help investigators determine, if they were stabbed and how they fell over, the position in which they were resting. Everything helps to piece the puzzle together, and there are experts in the field that can make inferences from the on-scene investigation and the on-scene evidence that is present. So photographs are generally the best way to go, because the picture, it basically captures the scene as it is. If photographs aren't available, the scene sketch or detailed notes also help. Often what they're recommending for us to do nowadays is to take a voice recorder and just turn it on while you're dealing with the person. This is helpful because sometimes it's the nature, or it's a reality of the job. Sometimes the victims don't always make it. However, they manage to get out a few words before they pass away, and they call this a dying declaration. So for example, if someone had been stabbed, they knew their attacker, they'd be able to say their name, and it gives investigators a point to start, or where to at least consider a suspect. Although people in the moment, because of the adrenaline and everything that's going on, may not catch what someone says. If you have a voice recorder, you can always play it back and basically isolate the audio and try to determine what that person said. Sorry, just reading a question here. Oh, they'll be brought up later. So all these methods provide invaluable evidence to investigators, courts, and parties interested in the matter. The way we testify in court is that essentially we try to paint a picture, because the reality is the first responders or the people attending the scene are going to be the people that saw what actually happened, or what it actually looked like, and the jury or the judge or the prosecutors or the defense counsel weren't actually at scene and have to rely on our notes and our testimony to get the best picture possible. So what you may not see in the first instance may be captured in a photograph or an audio recording, or even detailed notes of your recounting. There is also a thing called holdback evidence. This is something that you may or may not encounter, but holdback evidence is important, because holdback evidence is something that only the parties involved directly with the scene may know the answer to. Example would be neighbors will know someone was shot because they heard gunshots. However, only the victim and the suspect will know where and what manner that person was shot, and how the shots occurred, or how close they were together, or what kind of caliber the person was using, or if they were using a knife, if the knife had serrated edges, or if it was like a steel blade, or what color the gun was. This is all information that only those involved directly with the scene would know. And this information is important because it's used to prevent false confessions. False confessions are basically people who either are attention seekers or want to take the blame for someone else. For example, like a mother covering for her son or daughter. And so the holdback evidence is something that is not announced to the public. It's held secretly and securely close to the investigators, so that if the person confessing to a murder actually committed the murder, they would know exactly how they committed it, what they used, where they stabbed someone, or where they shot someone, how many times they shot them, they would know all this information because they were the person doing it. Rather, somebody who wasn't actually there would say, yeah, I shot him, but they don't know exactly where they shot them or how many times they shot them. And so holdback evidence is something you may come across. If you do come across, basically treat it as a secret. Don't tell anyone except for police investigators, obviously. So it's not necessarily something you would go home at night and say, post to social media about the incident that you saw that day. You wouldn't go to Facebook and say, oh my God, I just dealt with this body. A guy was shot 6 times in the leg. You wouldn't necessarily post something that would completely defeat the purpose of holdback evidence. Another point to consider is the isolation of witnesses. The reason we isolate witnesses is because witnesses like to talk, and witnesses talking to each other is never a good thing. As witnesses typically know what they've seen, however, when they start talking with other individuals that they've seen, this information quickly becomes contaminated and factually inaccurate. So the person may have seen a person, they describe him to a T with a black jacket and a beard, and someone comes along and says, oh, I think he had a red jacket. Well, that witness's perception sometimes is influenced by that other person who may have a stronger opinion. So the witness would have the actual information needed for this person, but now has been changed by this other witness who assumed that the person was wearing a red jacket. So that's essentially why we isolate witnesses and discourage them from talking until the incident is over. So what would you do if you arrive on scene first, or if you had to handle potentially important evidence? So just a warning or a caution that viewer discretion is advised. There are a few slides that may include some potentially graphic photos. Nothing too serious, but just be aware that the next few slides will have some potentially graphic photos in nature. So indoor crime scenes. So on the left, you can see you've got crime scene investigators photographing blood on a wall. On the right, you see an individual essentially dividing up the room, preventing people from stepping over the crime scene where important evidence may lie. These are examples of what you can do if you arrive on scene first. Not necessarily on the left where the investigators are in full bunny suits and photographing, but this is an example that if you had to walk through a door, for example, and it may destroy this blood pattern, consider taking a photo before it takes literally seconds to do, and this evidence may be crucial to the case later on. In terms of outdoor crime scenes, again, outdoor crime scenes are a little more difficult because they're exposed to multiple variables. On the left, you can see they're collecting road evidence. How many cars drove through that area before the police got there? How fast was the area cordoned off? How much of the evidence is still remaining? The photo on the right is a scene that I actually attended. I think I was about 5 minutes after they called it in, but I don't know how long that person had been in the bushes for before I even got there. It literally took me 5 minutes from the time they dispatched the call to get to scene. But this person was in the driver's seat. They had crashed into a bush and they were trying to back out and drive away. Again, I don't know if they've hit someone when I'm receiving the call. I don't know if they've hit someone or if they just drove off the road because of the weather or what's going on. But the fact is that there's still going to be a time delay between when the incident occurred and when it was reported to police. So in a case like this, a good way to cordon off the scene would be to block the roadway and try to prevent the person from leaving. Again, not physically trying to fight them off because you may get injured in the process. So recent news in Canada. So the first one was July 21st, 2016. Pemberton HCP were called to the Pemberton Music Festival campgrounds where someone had been stabbed. Another recent event was at the Canadian Forces Military Recruitment Center in Toronto, March 16, 2016. That's the Toronto Chief of Police speaking about the incident. So essentially, this is something either EHS, first responders, or even the hospital staff may experience. Basically, they would have to make the decision to cut off the clothes and remove the knife. If you were to remove the knife, for example, you might consider trying to remove it using parts of the knife that aren't commonly used. For example, you wouldn't necessarily pull the knife out by the handle. Maybe consider taking a rag and pulling it out from the base of the handle and where the blade meets. It's not very common for someone to touch a knife at that area. Thus, you're not necessarily going to destroy or contaminate evidence if you grab it in areas like this. A t-shirt, for example, let's say someone had been shot or the stab wound through the shirt, you wouldn't necessarily cut through that hole because that hole is evidence that the caliber of the bullet that was used or the type of knife that was used. So it's certain things to consider when dealing with this type of evidence. Again, outdoor scenes. These are both files that I worked on through the course of my duties. Highway 1 at 232 in Langley on October 23rd, 2013. This was a single vehicle that had crashed into a construction flagging vehicle. Luckily, in this case, there was only one fatality. And then there's the Pemberton fatal, which I'm sort of allowed to talk about now because it's been through the courts. This incident was a 6-month investigation. There were 2 cyclists that were killed in regards to, because of this, as well as the passenger in the vehicle. This occurred May 31st, 2015. So these photos themselves aren't from the actual collisions. However, they depict important elements that bolstered the case against the accused. So on the top left, you can see tire markings. These are tire markings, obviously from the vehicle on the roadway that helped the integrated collision analyst and reconstructionist team to determine the speed of the vehicle when braking was done and all the other factors associated to it. At the bottom, you can see an airbag. This is something that was crucial to the Pemberton fatal case because we had many witnesses, but nobody actually saw the accused sitting in the driver's seat. And so we had one person that had seen the accused in the driver's seat, but they weren't able to place them in the driver's seat 100% because they came around the corner a few seconds after the collision. And so it was hard for them to say with 100% certainty that the person was in the driver's seat. Thus, we had to write a search warrant for the airbag, seize the airbag, sent the airbag to the lab. We had blood splatter analysts that performed pattern analysis on the airbag themselves, and they could tell that the blood that was on the airbag was from a certain velocity. And so the person that was driving would have been the person that that blood came from. So it's not the person crawled from the back seat and blood all over the airbag. The velocity that the blood was put on that airbag is the only way that the blood got on the airbag. So the experts in the field are able to speak to this, but this is reasons why this evidence is important. And so tire markings or the airbags themselves, when they're exposed to the elements like the rain, for example, this evidence quickly washes away. So I wouldn't necessarily suggest cutting the airbag out yourself, but maybe put a garbage bag over the airbag to preserve that evidence, or put a tarp over the tire markings, or take a photo of them and pass them on to investigators. Without some key evidence So how can you increase the odds of preserving the evidence? There's a few items that can assist you in preserving the evidence. Here are common examples that are often carried in vehicles. So EHS, for example, often carries hospital blankets. I don't know if they carry any cones, garbage bags, cardboard boxes, even the reflective jacket that often some of us wear, or even some plastic wrap. There are many options available to the emergency personnel when dealing with these types of situations. And these items can be used to cover tire markings or blood or bullet casings, murder weapons, and it allows the forensic team to properly process the exhibits. So here's examples of how they were used. You see a body here. If this was Lower Mainland, this type, the way the weather has been this year, I would definitely recommend covering up the body to preserve any evidence that may be still at the scene or on the body, because if it starts raining, then that evidence will get washed away. On the bottom, you can see a pistol that was covered up with a special police casing. This could be the cover of a salad, for example, like a salad that you get at the store. Your imagination is basically the only thing limiting you. As long as things are kept basically as sanitary as possible, I would prefer having someone cover evidence with a salad container than to have the elements affected and lose that evidence forever. On the right, I've included what a scene sketch could look like. Again, this is done by law enforcement, so they might not necessarily be as detailed, but you can easily indicate before moving a body that they were found beside the couch, or found beside the stairwell, or found in the kitchen, and what position they were found. And these can be used as notes to refresh your memories for later on as well. So just a quick summary to crime scene assessment. We're provided with a basic flowchart as well. I've sort of adapted this one for healthcare professionals, and it's just a point form way of looking at how to deal with crime scenes. So basically, everyone arrives at scenes, and the priorities are to preserve and protect life, obviously. After that is establishing the basic facts and preventing the contaminations. These again are just basic and oversimplified to assist anyone arriving on scene, and they can use as a way to refresh your memory just in how to approach a scene, basically. So again, every contact leaves its trace. I hope that this phrase now has a little more meaning following this presentation, and that you may pass along your knowledge to coworkers in the field, making investigations better. Do we have any questions at this time?
While people are thinking about any questions they might have, Mandy and I were just chatting actually, and have come up with something. And Denny, I'm going to apologize here for contradicting you, but for those of us that are BC Ambulance employees, and for those of us that have other healthcare obligations, or which is most of us, you do have to be very, very, very careful about taking any kind of photos on scene. I'm not sure. I was trying to look it up and I couldn't find the actual specific BC Ambulance policy on it, because obviously a lot of us are BCS employees. But in the healthcare world, anything at all that could be considered personally identifying is protected and confidential information. The BCS policy does say that we can't transmit that out of the country. We can't record it on our personal devices. We can't take photos of anything that could be personally identifying. You can't even take photos of patients' X-rays, even with all their personally identifying names and stuff removed. There's some pretty strict privacy guidelines on that stuff, and unfortunately, there's some pretty big consequences if you do get in trouble for doing it. So that's something you should, for the folks out there, just be careful that you're not violating your own agency or company or employer's standards on that. I'd actually have to check what the official St. John policy is. I expect it would be the same, but yeah. Does anyone else have any? Or actually, I don't know if Denny, if you've got any any thoughts on that, or any points that you'd like to discuss. But it's a bit challenging for us as healthcare providers to take photos of things. Unfortunately, written notes are no problem, but taking pictures on scene can land you in a whole lot of trouble if you're not careful. Oh, pardon me,
Yeah, no,
Mandy's just clarified. She says, if our role forbid us to take pictures, what's our alternative? And if you've got any suggestions or thoughts on that. Sorry, go ahead now.
yeah, no, and my intention isn't to say breach your policies or anything, but that means I'm not familiar with the BCAS policy. So, I mean, if they have anything like that in play, then obviously go by your governing policies. This is more geared towards anyone at all who basically doesn't have anything preventing them from doing this type of things. If policies were in place, as you said, Nick, you can take detailed notes as to how the person was found. So detailed notes would be an example would be like you entered the household, you moved to the living room, the person was found with the head towards the wall where like a fireplace was located, or how their legs were, if their arms were crossed, or the more detailed, the better it is, basically, because it helps investigators get an idea of how that person was located and what was found on them, or if they were holding anything at all, or a lot of this information can help piece the puzzles together. And so even for ourselves, they tell us not to use our personal phones because if we, example, take a picture, that this is why they issue us work phones, for example, because if we take pictures with our personal phone, technically they can seize our phone until the investigation is done. And some investigations are quite lengthy before they get to court, and so you're looking at 2-3 years without your phone. So the idea is basically if you're able to get a just a digital camera, or even an outside source memory type thing, like if you take a picture with your phone and you have a expandable memory card that you can pull out and give to investigators, that is certainly a lot better than turning over your entire phone. But if pictures aren't an option, or recording audio isn't an option, just detailed notes as much as possible to remember all those details, so that it may assist the investigator throughout the course of their investigation.
Perfect. Thank you, Denny.
Sure.
We've got another question from the gang in Victoria. We have several listeners there. What is the implication of being called in court? Is it only as a witness, or would we need to have an attorney present?
No, typically it'll be as a witness. Basically, for the Pemberton case was probably a good example. Often EHS workers are called to court as witnesses to testify to, for example, while transporting to the hospital, if they administered any drugs, if they administered any substances or anything like that. They have to be able to speak to what they gave to the person, because the most common cases where we deal with this is impaired driving cases, where you have to be able to say, yeah, I gave that driver some morphine or ketamine, and that this is why they were acting this way post arrival, and that anything else in their body that's found was not because of you. It was because of self-administration, or they found it some other way, but it's not because of your implications in the case. But unless you intentionally cause damage to a person, or kill a person, or do something criminal, there generally is no requirement for an attorney. It's just you're there as a witness just to say what you saw and help the court understand what happened that day.
Perfect. Thank you very much, Denny. We've just had a very helpful piece of input here from Waikiki Lee. For those of us who are BC Ambulance employees, there is a specific policy on this. I'm just going to mention this. Obviously, this is a St. John seminar, but I know a lot of folks out there are BCAS people, so This is hopefully going to be useful to them. Policy 5.1.1 in Volume 1 is the policy dealing with cameras and electronic devices. And it does say that paramedic cannot use a camera or other electronic device to record patient information. Despite this restriction, management may authorize photography when necessary for, and then there's a bunch of stuff that's probably not relevant to us, but it does include medical purposes as a reason that management might authorize photography. So, if you want more clarification on that, you need to talk to your supervisors or whatever. But BCAS policy 5.1.1, Volume 1 is the area that deals with that. We do have another couple of questions here. Oh, I just lost it. From Mandy again, do we need to be concerned about what to say or not say, or how we say things, sort of in the context of a crime scene, and I guess communicating with the police?
I wouldn't necessarily be worried about what not to say or what to say. Basically, just say what you observed. Don't make up details, and don't go out of your way to embellish the details. If you didn't see anything, you didn't see anything. In the case of EHS, if you only administered one drug, or if you had to intubate the person, or if you only applied a bandage, that's all you did. I wouldn't say that. You could say why you did what you did, like, for example, it's consistent with your training, or if you felt it was the right thing to do at the time, and explain why. And it helps quantify your actions. So you're not saying, oh, I just felt like putting a bandage on them and that's why I did it. You're saying I put a bandage on them because the person was bleeding. I was trying to stop the bleeding and tried to sustain life until qualified experts were able to deal with them, type thing. So it's not necessarily being concerned. If you provide a statement to police, for example, and some information is missing, the police know exactly what they're looking for, what elements of the offense, and what additional information may help. So if you fail to mention that in the statement, for example, they already know what they're looking for, so they may prompt you to those questions and look for answers, and they'll guide you towards what they're looking for. If you know it, you know it. If you don't, then again, don't make it up. Just say, no, I don't know, or I didn't see that, or I'm not sure.
Great, thank you, Denny. We have another question from Tanis Kraus. If we are on scene as a first responder or bystander, how long do we stay on scene? Do you leave with the patient and contact police after you are done providing care?
That's a good question. It depends really on the situation. Every situation is dynamic and very different in itself. And so if you were critical to the care, for example, let's say you were doing CPR and they were going to bring you in the ambulance to continue CPR while you're on the way to the hospital, I would say leave with the ambulance. If you were just there to hold their hand and provide support and you saw everything, I would stay on scene till you spoke with the police and give them your contact information, and they're more than likely going to take a statement on scene from you based on what you saw. If they can't, at the very least, they'll take your contact information, and if, again, it's a very dynamic situation, so they may arrive shortly after the incident, or they may arrive 15 minutes after the incident. It depends where you're located and what the resources are like. At the very least, if you're not able to speak to a police officer and you absolutely have to leave because you're writing an exam or have to catch a ferry or whatever the reason is, you can always call the non-emergency line and say, this is who I am, this is what I saw, and they'll forward your information to that investigator, because every case essentially is assigned a lead investigator, and it is their job to go through all that information and organize it in a logical fashion. So basically what I'm saying is stay on scene if you can to speak with police unless you're required to go with the patient. And if you're not required and you can't stay on scene, at the very least, call the police detachment to provide your information so they can follow up with you.
If you don't mind me jumping in a little bit on that one, Denny, the question, and Tanis, please feel free to correct me if I'm misunderstanding, but this might be in the context of being with the ambulance service and transporting a patient as well. The general rule for EMS is to always put the care of your patient first, and the assessment of a potential crime scene, while being very important. If your patient is sick and needs to be in a hospital, you shouldn't be waiting around to talk to the police. Do make sure that dispatch knows where you are and who you are, and that the police might wish to talk to you. And they're pretty good about communicating that back down to the local police departments. I have another question from Burton Sang. What happens if we do come in contact with an item of evidence? Will we also be tracked down?
That's a good question. Yes and no. It depends. Again, situations are very dynamic. It depends on the importance of that evidence. It depends on how it was located, how it was determined to be evidence. Long and short, the answer is it depends. But if it's, for example, a murder weapon, then more than likely you'll be giving a statement and you may be called to court to say, this is where I found it and I turned it over to police. And that's just for continuity of the evidence, or the chain of custody of the evidence. And that's basically to say that you arrived on scene and nobody else touched it, or nobody else touched it from the point you found it. So they can't say that evidence was planted or anything like that. So again, it depends on what it is and when it's found, or who finds it with you, and what the significance of that piece of evidence is.
Perfect. Thank you, Denny. Sorry, I'm just going to say, do we have any other questions from anyone else in here? Oh, Sue Copeland, I see. I've been chatting privately here with Sue Copeland, who just had some more questions about whether doctors in the emergency department would appreciate car crash pictures to sort of assess the mechanism of injury for the patient. So Sue's question was, I've heard that doctors in the ER have appreciated car crash pictures in order to help diagnose patients. Does that qualify as a crime scene photo and something that we should not pass along? I think so, and she's then clarified that she's not with BCS or another agency. She's new to St. John, and she's asking in the context or capacity of a bystander, paramedic, or sort of a civilian. I don't know, Denny, if that's still sort of within your purview, or if I could certainly add some thoughts to that. But if you have anything first.
Yeah, I mean, I don't know that they rely heavily on any evidence that's shown to them. Typically, my experience with doctors has been they evaluate what's wrong with the person and they deal with it, whether it was a 6-car pileup or just a single vehicle off-road. They've always asked me what happened, but they haven't really asked for pictures or anything like that. But I have had people in the past take pictures and pass them on to myself, and we basically add that to the Crown Council, or the report to Crown Council, and it forms part of the disclosure package. And so it might be, sometimes they're very, very good pictures that provide a different angle that changes the scenes. For example, what that means is if it happens at dawn or dusk, the light is obviously different when by the time we get there, right? So sometimes it can be full daylight and it's not a true depiction of what the crime scene was like at the time. And so those pictures might not necessarily help the doctors, but they can help police investigators determine what the scene was like at the time.
Yeah, I think everything Denny has said there is pretty much spot on. If you're a private citizen, a lot of people don't know this. My background was actually as a professional photographer for a long time before I was a medic, so I'm fairly familiar with the photography laws in BC. If you're a private citizen and you're standing on a piece of publicly accessible land, you can take a photo of whatever you want, and unless the person that you're taking a picture of has a reasonable expectation of privacy, you're able to take that photo. So if you're there as a private citizen, you're not in uniform, you're not representing another agency, unless the person you're taking a photo of is behind a curtain or something, and you're pulling the curtain to one side and sticking your camera in there, you can take photos of all that stuff. Certainly from a professional standpoint, even as an off-duty care provider, you should be doing everything you can to be respectful and constructive in your care of the patient. If that means getting a photo to the ER so the doctor can understand what happened, or so the crime scene investigators can understand what happened, that's great. Just be appropriate about it is the best advice I could give. We have one more question from I hope I got the pronunciation on this right, John Beeftink. What are the restrictions for removing items from a scene? For example, a motorcycle helmet to show the attending physician in the ER. I'd really like to know an answer for this too, because this is something that I will do regularly, Denny, is if we have a cyclist helmet or a motorcycle helmet, we'll take it with us. But obviously that could be an important piece of evidence for an investigator. So what are your thoughts?
Yeah, my recommendation is don't do it. If it's attached to the person's head and it's going to come with them regardless, or it's going to do damage to take off the helmet, then obviously take it with them. But it's important in that case, and the thing that popped into my head right away when I read that question was hit and runs, for example. There is often a lot of times where people are hit by cars, for example, like ped trucks is what we call them. And an interesting concept that was brought to my attention on my first few years of service is that the shoes, for example, when a person is hit, actually stay where that person was hit. Like people are literally ejected out of their shoes and the shoes remain there. And that actually is a very important piece of evidence for the collision analyst and reconstructionist to use their calculations, and it helps determine the speed of the vehicle and how far a person was projected. And again, this is going a bit out of my field of expertise, but essentially, if the item is there, note it and point it out to investigators. But I wouldn't start moving things around, because then it can skew the calculations, or it can mislead investigators down a wrong path type thing.
Thank you very much, Denny. We have a quick question from Burton Sang again. If we witness a crime, would we preserve life, or should we try to preserve the scene? If you don't mind, Denny, I'm just going to answer that as an EMS provider. Our priority is absolutely always to put the care of the patient and their well-being above really anything else except our own safety. So if there's a question of allowing someone to bleed to death in front of you, and you're worried about disturbing items on a scene, take care of your patient first. And I don't know if you have anything else to add to that, Denny, or not, but.
Yeah, no, I agree with you. It's definitely, life is definitely the first priority. The scene that pops into my head, and not to pick on firefighters, but they're known in my world as the evidence eradicators. And basically, they come into the scene and they basically put out the car fires with their hoses and start chopping cars up and stuff like that. And I make jokes about it all the time, because there's this feud against firefighters and police officers. But realistically, if you're able to remove that person to provide care to them, or provide care to them until the ambulance gets there, and then put them in the back of the ambulance, as long as you're not kicking, let's say you happen to walk by the knife that they were stabbed with, don't kick the knife over, obviously, or don't throw it out into the field or into the water. An example that comes to mind, again, working with the underwater recovery team, we had a call once. It was a father and their son walking in the park, walking their dog, and they came across a gun on this path. We didn't know if this gun was used in a crime or if it was just dropped by somebody or whatever the case was. But they essentially picked up the gun and they threw it into this man-made serpentine. This happened in Surrey, just off of the King George Boulevard. And he was not even going to call police. He essentially was brought to our attention when he came back to his vehicle. His vehicle had been broken into. He called police to report that incident, and he said to the investigator, "Oh, by the way, I threw a gun in the water." And so that's prompted them to call the dive team to search this man-made river for this gun that the person threw. So, long story short, basically, if you're saving life, I would say that is definitely the top priority. Just be mindful that there might be some potentially valuable evidence while you're dealing with this person.
Thank you, Denny. One more question from Joyce Robertson, and we're kind of at the end of our time here. We're a few minutes over, actually, so I'm going to say this is our last question of the evening. With the move to try and charge drug traffickers, are we expected to protect needles, etc., in overdoses that we are attending when the patient does not survive? And this is sort of targeted specifically at the St. John Ambulance opioid crisis response, but this is obviously relevant to other frontline providers as well.
I haven't had much experience so far with, not in terms of law enforcement yet, with drug traffickers and people overdosing from those needles provided by the drug traffickers or anything of the sort. Basically, I would seek advice from the surrounding agency. For a place like Surrey, for example, it might not be a priority for them. Their priority might be dealing with the overdoses, versus a place like Burnaby might be dealing with the people providing the drugs. It's every detachment has different priorities, and those priorities are set by the OICs or the officers in charge and their teams. So I wouldn't be able to give you a definite black and white answer to that question. It would basically be just consult with the local enforcement agency of that city or region and see what they recommend. They might be going after, I know in the US they are going after drug traffickers, and if they're trying to prove the nexus between that drug or that needle that caused that person to overdose, and they're charging the drug traffickers with murder or attempted murder. I haven't heard of a case of that in Canada yet, but that's not to say it won't go that way. Things in the legal system take time, and they have to be built on case law and other cases that have occurred previously. So long answer short, basically consult your local law enforcement to see what they would recommend or what they're willing to go with.
Perfect. Thank you very much, Denny, for that. Also, thank you very much for everything. This has been obviously put a lot of work into this. Has been a great presentation. I'm sure we all really appreciate it. We've got quite a few people listening in and watching from around the province. So thank you to them as well. Thank you everyone for again for participating. Thank you again, Denny, for your absolutely phenomenal presentation, all the hard work you put into it.